Hello, so today we're going to be talking about IT band syndrome again. I wanted to talk a little bit about the anatomy of the IT band and how to tell whether or not strength is an issue in your IT band problem. So if we look at the anatomy of the IT band again, if you remember from the last video, the IT band starts up here on the pelvis and it travels down the outside of the leg and it inserts right here on the outside of the knee. So that's where we can have friction here on the outside of the knee or up at the hip. So there are a lot of muscles around the hip and leg that attach to the IT band. The IT band is kind of controlled, the tension on it is controlled by the muscles that attach to it. So if we think about standing on one leg, your IT band, the muscles around your hip have to contract to hold your pelvis up so that your pelvis doesn't drop like this. Because if it drops like that, more tension is put through the IT band, causing increased friction on the bone here and on the knee. So the idea, if your IT band problem is associated with weakness, is to strengthen the hip and the other muscles that attach to the IT band and even the core to help stabilize your pelvis as you're running or doing whatever activity that you're doing. So a quick test that we do in physical therapy to see if weakness is playing into this is if you stand on one leg. First of all, can you stand on one leg with your pelvis being even or level, and then standing on one leg and going down into a single leg squat. I'll move back a little bit so you can see it. Going down into a single leg squat. So go ahead and do that before I tell you what we're looking for. Maybe you could pause or something like that. But now what we're looking for is, as you go down into that squat, is your knee collapsing to the inside. If that's happening, then your hip isn't controlling where your knee is going. If your knee goes straight in line with your toes, that's what we're looking for, is that nice straight line rather than the collapsing to the inside. So if you're noticing that, it's probably at least part of your IT band issue is a strength issue. And we'll go over in videos later on in the week some strengthening exercises that can help with IT band pain. But for right now, that's just a good way to identify what the cause is. So until next time.